Hi, I'm Glenda Christian. I am a registered dietitian with Diabetes Dayton, and I'm here today to go over what diabetes is for yourself or to know the signs and symptoms that you might be able to help out a family member or a friend. We are a service that has resources for those living with diabetes. There are several types of diabetes. Type 1 diabetes is where your insulin-producing cells, called the beta cells or islet cells, no longer respond or produce insulin. And this person would be an insulin-dependent diabetic. They do require insulin from an external source, whether it is getting shots or getting it from insulin from an insulin pump. And this is a condition that cannot be prevented. Whereas in type 2 diabetes, it is the most common type of diabetes in the United States. And it's where the pancreas doesn't make enough insulin or insulin that is productive and works within the person's body. Signs and symptoms of diabetes are extreme hunger, extreme thirst, frequent urination, rapid weight loss, that's usually with type 1 diabetes, fatigue, drowsiness, blurred vision. Some people will notice that their wounds aren't healing properly like they used to, and some people get numbness or tingling in their hands or feet, and that is just a complication of uncontrolled diabetes. Prediabetes is a type of insulin resistance where the person's insulin is not being utilized effectively in the body, and the insulin needs to be able to get into the cells to get the blood sugar out of the bloodstream into the cells. Sometimes these individuals tend to be overweight, and it can actually be prevented with lifestyle changes. So those with prediabetes, if they are overweight and can lose weight and exercise, eat properly, sometimes they can prevent becoming a type 2 diabetic. But without lifestyle changes, most likely they will become diabetic, type 2. Risk factors for diabetes cover family history. Sometimes that is a factor that affects individuals. Certain ethnic groups like African American, Asian, Pacific Islanders. If you're over the age of 45, if you have elevated lipid levels or like cholesterol, triglycerides, if you have a history of vascular disease, polycystic ovarian disease, those women that have had gestational diabetes are at a higher risk of getting diabetes down the road. If a person is overweight or obese, and sedentary lifestyle. If the diabetes goes uncontrolled, it can lead to a lot of complications such as heart disease or stroke, kidney disease, blindness, nerve damage, loss of fingers or toes. And with all of the different areas you see there on the screen, those can all be affected because of the microscopic capillaries that are in our eyes and in our fingers and toes. Diabetes Dayton can help individuals that have diabetes. We are an agency of Life Care Alliance. We want people to be aware of diabetes. We support those with diabetes, and we also provide education to help the community. Diabetes 101 Survival Skills covers medications and how to use those properly. We also go through basics of meal planning, how to monitor your medications, and we review what blood sugars range should be. In the 102 class, Nutrition and Wellness, basics are to do meal planning, review proper nutrition. We also go through carb counting and give you the basics on that. We go through each food group and explain, for example, what starchy vegetables and non-starchy vegetables are and how to eat more properly to help control your blood sugar. I do medical nutrition counseling, and that's where you can come in and I can help you learn how to improve what you are currently eating and how you can eat to control your blood sugar. We can discuss what foods affect your blood sugar the most, and we can also go through and devise individual meal plans for you. And if you need to lose weight and exercise, I can give you guidelines on that. As far as our education classes, they are free. They are each 3-hour sessions for 2 different Saturdays, the second and third Saturdays of each month. Registration is required. You do not need a physician referral, whereas you do for the individual medical nutrition counseling. And that medical nutrition counseling is run through your insurance. But as far as the diabetes education classes on Saturday, those are free for the community. And we don't turn anybody away. We just ask that you let us know if you're coming. And then the number to call is 937-220-6611, and we'll be glad to help you out there. Clients that have come, they have found it to be very educational and very helpful. We do have a supply pantry, so this is something where we can help those that are uninsured with a 1-month supply of strips and a meter, and we can do this once per calendar year. Additional supplies we can help people with are syringes, pin needles, sharps container, and alcohol swabs. We also have a medical device that is like CompuNet or other companies where you can come in and get an A1C testing done for $20. It does require an appointment because we need to get this machine set up for you. And that is a lot of times less than what a copay would be as far as the $20. You can get your results in 10 minutes and we do not need a prescription. As far as our low-cost testing items, we have the Bi9 GE meter for $10, and we have the Bi9 GE strips, a box of 50 for $10. We always have these in stock, and again, we do not need a prescription, and it can be a lot less than your current copays. So that would be something you could get on a regular basis. We have a youth camp for kids that are ages 7 to 17. And for those kids with type 1 diabetes, it can be a life-changing experience. It helps them form friendships, and a lot of these end up being lifelong friendships. With technology this day and age, these kids can stay in touch with each other. It teaches them how to be more independent, gives them skills that they can manage their own diabetes. A lot of times they've had their parents there to help them along the way. And this just helps them to feel more in charge of their own health. The doctors, nurses, dietitians that are at camp, we have counselors on site. It is a very, very safe camp for these kids. And it also gives the parents a reprieve from the constant care of having their child at home. How to contact us. Our phone number is 937-220-6611. We have a website, www.diabetesdayton.org. We have a lot of information about our services on the website if you want to review that. We also have an email address, admin@diabetesdayton.org. And we are located at 2555 South Dixie Drive, Suite 112, Dayton, Ohio, 45409. And again, I am with Diabetes Dayton, Glenda Christian, and I want to thank you for joining us today. Hopefully you have had information that will help you or a family member learn more about diabetes and our services. And we are here to help you. We are a nonprofit organization, so we do accept donations, and you can contact us on the information that's on the screen. Thank you again, and have a great day.